Close your eyes and let your heart take you on a journey. Envision a world where you never have to worry about your family's health again. Imagine not having to think twice before rushing your child to the nearest healthcare facility. Picture the relief of knowing your grandmother, who needs her medication at midnight, is 100% covered, with no questions asked. Consider a world where your spouse's hospital bills are processed and paid in real time during an unexpected health emergency. From as low as 365 CDs a year for 9,000 CDs coverage, with service providers enjoying instant payment with real-time updates on coverage limits. Not a moment of stress or financial worry in sight. Now, open your eyes. This world is no longer a distant dream. This world has arrived. This is the promise of DOSH, a promise to take care of you and those you love most. Embrace this heartfelt revolution. DOSH is here for you, because with DOSH, every moment of health is a moment spent with family. Remember, you can earn 20 CDs for every successful referral of anyone when they join the DOSH Revolution. Call us toll-free at 0800-DOSH-ME. That's 0800-367-463. You can also dial star 915 pound or hash key, or WhatsApp +1 203 293 9850. Visit us online at www.0800dosh.me. DOSH, nurturing life's most precious bonds. Terms and conditions apply. Always refer to your plan documents for detailed information.
Many people work hard over the years to build assets. You know that they grow their business, they support their families, and they plan for the future. Yet one unexpected medical emergency can suddenly drain all your savings, create debts for you, or disrupt your long-term financial plans. And that's why today's conversation is not just about healthcare. It's about asset protection, financial stability, and peace of mind. So joining us this morning in the studio is Miss Berlinda Amoo. She's head of sales and marketing at DOSH Health Insurance. She's going to help us understand how we're linking our health insurance and, to practical ways that we can safeguard our finances and protect them for ourselves and our families. Hi, Berlinda. Good morning.
Hi, Motiti.
Good to see you.
Good to see you too.
Okay. So health care and insurance. For viewers who may not even know who DOSH is, they're hearing it for the first time. Tell us.
Okay, so DOSH is a private health insurance scheme duly licensed by the National Health Insurance Authority. Now, we facilitate medical care using state-of-the-art digital technology. From our customer acquisition to our claims processing, we are using digital technology to serve our clientele.
Oh, wow. And that's what makes you different. That's what DOSH is,
exactly.
Digital technology. Ghanaians assume that, health insurance, private health insurance may be expensive. How is this different?
Well, DOSH has been driven by 3 A's. That is our key value proposition to Ghanaians. Now, the first A is affordability, and so that brings me to breaking down my health insurance plans for you. With as little as 365 Ghana cedis per person per annum, we are offering 9,000 Ghana cedis to you as your annual sum insured. So 365 Ghana cedis, that's just about a cedi a day. We have 365 days
in a
exactly.
year. Okay.
So just 1 cedi a day, and we are giving you 9,000 Ghana cedis for the whole year as your insurance benefits.
Okay.
Now that's our basic package, and the next one now. The names of our health insurance plans is the premium we charge per person per annum.
Okay.
And so the DOSH 365, that's the 365 Ghana cedis, offering 9,000 Ghana cedis.
Okay.
Then we have the second one, DOSH 750. And the premium is 750 Ghana cedis, and the benefits for the whole year is 18,000 Ghana cedis. Then we have the third package, that is the DOSH 1000. The premium is 1,000 Ghana cedis per person per annum, and the benefits for the whole year is 30,000 Ghana cedis. That's really affordable. Yes, then we have the upper end packages to the DOSH 2,500 offering 60,000 as your total sum assured, the DOSH 5,000 Ghana cedis, 95,000 Ghana cedis as your total sum assured, and the DOSH 10,000, 190,000 Ghana cedis as your total sum assured for the whole year. And so these are packages that shows we are really affordable. I mentioned affordability is one of our key value proposition. The next one is also availability. Wherever you find yourself in Ghana, in the comfort of your home, you can visit our web www.0800dosh.me to subscribe, or your MTN phone, your mobile money, your Momo phone, or your, yes, you can just go to the mobile money app, Momo from MTN app, and then subscribe. You go to financial services, you can subscribe, or call our call center 0800 367463, and you can engage any of our call center personnel to help you.
Wow.
Yes.
So it vastly cuts across, as you mentioned, from the affordability, from the lowest to the highest, as you mentioned, with the DOSH 365 upwards. What kind of illnesses are covered under this?
Well, so all our packages, from the basic to the upper end package, it covers outpatient services. That includes GP consultation, specialist consultation. It also covers physiotherapy, chiropractic services. It also covers inpatient services, admission, detention, emergency services are all included. It also covers, for the inpatient services, delivery, whether cesarean section or normal delivery. It's also covered.
How vastly seen are you? Where are you located? Are you only in Accra?
No, so our office is currently in Accra, but we have accredited service providers nationwide. That is hospitals, clinic, polyclinic. And DOSH is the first health insurance scheme to partner Ghana Health Service. So all Ghana Health Service facilities, from CHIP compound to polyclinic, district hospital, even the teaching hospital, the Kolebu, Komfanochi, Tamale,
because you mentioned the preparation for pregnancy and the cesarean preparation. So if anybody signs on to that, they can contribute to be able to have that safely done. Amazing. Tell us about payment options. You have to pay the premium in full?
Yes, so you can pay the premium in full. Or we have a 90-day period that you can also pay. So, for example, if you're on the DOSH 365, you can spread the premium within the 90 days. So a day for the 365, you'll be paying like 4 CD 10 pesos. That is, I mean, cheaper than the cost of kinky. Very affordable.
Are you sure you won't get kinky at 4 CD?
Oh no, please. Kinky is 7 CD now.
Oh wow. Okay.
Yes.
Okay, but your area, is it your area that's the kinky?
I mean, the least that you can get is 5 CD, and even that one cry. I mean, I can't do anything with the
5 CD. The doctors advise that you should eat banku like this. So they are saying 5 CD kinky, but won't do anything.
The doctors are the issue.
Or because you are signed on DOSH, so you're covered. But tell us about the age limit on the policy. How does DOSH handle persons with pre-existing medical conditions and age limit?
Yes, so DOSH covers persons with pre-existing medical condition, and for the age 2, from 0 to, usually private health insurance, the cutoff age is 60, but DOSH, we've made room for people above 60 years. So you can be 80, 85, 90, or 110 years. You're still welcome to DOSH.
Wow, interesting. Many insure cars, homes, businesses, as I mentioned earlier on, and then they ignore health insurance. How should we see health insurance as an asset that we should, pay keen attention to?
Okay, so usually when we think of saving, investing, buying that nice car, or even save towards these things, but we usually do not put our health into consideration. The truth of the matter is you can do all these savings, but when you are unwell, you cannot even use them. Again, just imagine you don't have health insurance, and you visit a hospital for just a malaria treatment. That will cost you between 1,000 to 1,500 Ghana cedis. Now, DOSH is asking you to invest 365 Ghana cedis. That's our basic premium. And even that 365 Ghana cedis, we've even made room. You can pay 4 CD, 10 pesos a day within the 90-day period, and we are giving you a cover of 9,000 Ghana cedis. If you have DOSH and you are unwell, you are very confident to walk into any facility or hospital, and because it's not going to cost you that much. But if you don't have insurance at all, especially DOSH, you are going to pay 1,000 cedis or 1,500, depending on the facility you visit. And so it's very important that as we are investing towards these needs or these things that we desire, we should also take our health seriously and invest towards that as well.
That's true, because you never know when you'll be hit, and you have to get financial support for that. Technology is driving industry now, and you said DOSH is very keenly into technology, and that's why you have the Amoo by MTN and all of that. Insurance, sometimes people are worried about, will I really get my money if I put it there and I'm critically ill and I need the money now?
Yes, so with health, it's not about, especially with DOSH, we do not even have to pay you back. When you subscribe or you enroll on any of our health insurance plans and you are unwell, we have accredited health service providers nationwide. I mentioned some of our facilities include the Ghana Health Service facilities, the clinic, polyclinic, district hospitals, teaching hospitals. We also work with Christian Health Association of Ghana, so the Catholic Hospital, the Mission Hospitals, and even private hospitals, the Nyaho, Accra Medical, and all those hospitals are also, and standalone pharmacies and diagnostic centers, or what we will call laboratory or scan centers,
are also included.
And so there is no cause for worry. You do not have to come ask to retrieve your money. You walk into our accredited process. Yes. You walk into our accredited health service provider, and if you have DOSH or our hospitals, and then you just tell them I'm on DOSH. Now someone will be wondering, okay, so if I subscribe today, how do I get my insurance card? I mentioned we are digital, and so when you subscribe, your telephone number becomes your DOSH Health Insurance number. And so this morning I go to Kolibu Polyclinic, I'm unwell, I just tell them I'm on DOSH. They'll ask for my membership number. That is my telephone number. So you start with the prefix 233, 244, and whatever it is, you just add it. They will verify you. Now you get an OTP, a one-time password on your phone. When you give it back to them, they are able to see your picture, the plan you have subscribed to, all your benefits, and you'll be served. So you don't even have to come to us for a refund, for a repayment, or anything. You'll be served. The bills will come to us.
The system is connected.
Exactly.
I was going to say, so could somebody use somebody's phone number? Fraudulently do that. But you mentioned the picture will come.
Please. Yes, please. Now, the good thing about DOSH too is that we guarantee peace of mind. You know, there are some health insurance schemes you go and then they say, oh, your insurance having paid. They will not tell you directly, but oh, sit here and then we are coming. We are coming. 1 hour. We are still coming. But with DOSH, that peace of mind is guaranteed because we pay our health service providers on real time. Right after service delivery, we ask that after 24 hours of service delivery, they should send the claims to us and we will reimburse them. And so you are assured of that peace of mind.
How long has DOSH been existing?
This is our 3rd year of operation, but we got our license in 2021 December. Yes.
Is there anywhere people can see success stories about DOSH? They can be rest assured that this is a trusted health insurance?
Yes. For me, I always say the first point of contact is the service provider. You went there, you were served, and we paid them. That's the most important thing because they need your money to run their business. And so if you're a service provider, a hospital, a clinic listening to me, and you are not on DOSH, please join DOSH because your money is guaranteed. Right after service delivery, we are going to pay you. And that also grants the customer or the prospect who is also interested in DOSH that peace of mind that when you subscribe or you enroll on DOSH, that peace of mind is assured.
Absolutely. So people can roll on You can roll on your children, is that it? And then you pay for them 365 in 90 days.
Yes,
for
please.
9,000 cities. And workers, who else is your target audience?
So everybody.
Okay.
Usually private health insurance is left for the corporate people, but we are even interested more in the individuals, the church driver, the tomato seller, the market woman who is not insured. You can enroll on DOSH. You do not have to belong to any corporate institution. And even small businesses that have 6 employees, 10 employees, less than 20 or even above 1,000, we can enroll you. You are between 10 to 15, we can still enroll you.
Right. Final words, what would you leave our viewers with? That this is a very interesting and excellent way of ensuring your health. Just as we mentioned, we insure everything else, but we forget about health, and DOSH is the go-to when it comes to this.
Yes, so I would say again that asset protection is very important, the same as your health. And you can do that. You can protect your savings, your investments, by making sure that you are well. And how do you make sure you are well? People say that, oh, me, I don't get sick. Me, dear, but even car cry, the cost service, and I'm a boy. So please get on DOSH. Have a good health insurance policy or cover for yourself.
Right.
When you're unwell, you can visit any of our providers. Also, when you just imagine, you see, there are some ailments that when it comes, it wipe away all your savings. Not just you, but even your family.
Yeah.
And so imagine you suffer from a chronic disease that all the investments and the savings you've made towards the future, you have to use it for your health needs. Please get on DOSH. And I would also want to repeat our numbers.
Yes, please
0800 367463. 0800 367463. You can call our 24/7 to a free number, and you can speak to any of our agents.
You have a website, social media, that if I go, I can see the accredited or the facilities that are, linked to DOSH?
Yes, so on all social media platforms, DOSH, DOSH Revolution, and then our website, www.0800 367463.
Right.
Sorry, I mentioned the telephone number plus
the website.
So the website is www.0800dosh.me, www.0800dosh.me, and then our telephone number.
Information. So
yes, our telephone number is very important to me.
Go ahead.
0800 367463. 0800 367463.
Absolutely. You've given the viewers, all the avenues that they can reach you from, and I'm sure people are either writing, scribbling, or going to your Facebook at DOSH Revolution.
Yes,
that's what you said right now, and the website as well. Thank you so much, and I'm sure that the information well seated about DOSH Health Insurance, the awareness creation on investing in your health, just as you insure everything else, your savings, your family finances, and all of that, because you or a family member will visit the hospital. Miss Berlinda Amoo is head of sales and marketing at DOSH Health Insurance. She helped us understand all of this. Thank you so much.
Thank you.
Shout out and happy birthday to Millicent from GTV marketing team, digital and marketing. Happy birthday, Millicent. You know that we love you, and we're still looking for you and waiting for you. We're back with Lifestyle with Valerie. Just stay.